H1N1 do have some type of underlying chronic condition. And people who have probably 50% of the mortality out there in the hospitals are from patients who have underlying chronic problems. So I personally would strongly suggest the H1N1 for your child.
And if her child's doctor is still hesitant, go see another doctor, go to the
health department will also have vaccines. So.
All right, very good. Doctors, thank you for being with us. We're going to talk more after a quick break. You are watching Docs on Call on News 25. That phone number to call, 698-3742. We're back right after this.
How can I find a doctor who's perfect for me? Like one with extended hours, who specializes in cardiology, or is a woman, and is near my home or work.
Methodist Medical Group has 85 great doctors for you to choose from. So with one call, you'll find a doctor who's a perfect match for you. Methodist Medical Group. Call 877-64-MY-DOC or visit My Methodist Doc Finder at methodistmedicalgroup.org.
Welcome back. This afternoon, the federal government confirmed a pig tested positive for the new H1N1 virus. The government and pork producers insist bacon, pork chops, and other pork products that we eat are safe, and that there's nothing unusual about a pig getting swine flu. But will you still eat pork? Tracy Potts is in Washington with the latest.
The world happens to be.
The Agriculture Department tested pig samples from the Minnesota State Fair after children in a nearby dormitory got sick from swine flu.
We've got widespread novel H1N1 in people right now. It's not unexpected that it spills over into pigs.
One pig sample tested positive. More tests are being conducted. But the pork industry insists you cannot get swine flu from eating meat from pigs, even if those pigs were sick.
They get sick, they recover after a couple of days, and then those pigs are perfectly fine. And with this being a respiratory disease, it doesn't get into the meat, so there's no problems with foodborne illness.
The pork industry took a hit last spring when H1N1 emerged and several countries banned American pork. The government's now reminding those nations that pork is safe. The bigger concern is how this virus is affecting humans who were perfectly healthy. Some have died, others recovered. Scientists think in some people the body's immune system overreacts and damages the respiratory tract in the process.
It's a delicate balance between your body making enough of an immune response to slow down the virus's replication versus too much of an immune response, which can lead to tissue damage in and of itself.
More shots were given today. In Florida, there's such a demand that the state is considering rationing its vaccine. And how effective might that vaccine be if the virus starts mutating in pigs? Experts tell me with the current form of the virus widespread, that's not a big concern right now, but it's something to keep an eye on. Tracy Potts, NBC News, Washington.
And speaking of flu clinics and rationing, we are just learning of several clinics that are being held locally. For all the details on where those locations are, you can go to week.com. And meantime, we've got some questions from callers that are written down for us, and I want to start with this one from Rick. It says, how much is lost of the H1N1 test? Is that reason why doctors won't advise? How much is the cost, rather? Is that the reason they don't advise testing? Is it simply cost, or is it really something more?
Well, the PCR test is about $388, but also it takes a whole week to run that test. So in order to really identify an actual H1N1, it takes a while, it's expensive, and by then the patient might either be very, very ill or over it. So the big question is, you want to know for surveillance reasons, to see what's in your hospital, and to know what percentage of the positive influenzas out there are truly H1N1.
Because most of these cases can be treated at home,
that's
right?
That's exactly right. So I think your rapid test, if you want to know at this point, the majority of those are H1N1 just by the surveillance that's been done.
Ed says 66 years and up, why are they not targeted to receive H1N1? And so this is going outside the realm of kids, but we've got lots of grandparents out there who are around their grandchildren, and they're wondering, why am I not supposed to get it?
Well, the CDC has been looking at the stratification of who gets the sickest with H1N1, and actually, fortunately, if you're older, you aren't you don't have as many complications from H1N1 from a percentage standpoint as some of the younger crowd.
Might have some built-in immunity.
Yeah, and so that's why they haven't been targeted for specific H1N1 as of yet.
All right. We've got another question from a caller. Beth is on the line. Beth, what's your question?
Yeah, hi. We have a 2-month-old at home. And our question is, if we get the H1N1 virus or vaccine and I'm breastfeeding him, do those antibodies transfer to him? Is he protected better if I get the vaccination?
Oh, wow. What do you think about that?
I think that's a really good question. I don't think anyone really knows for certain, but there are a lot of great immune globulins that are transferred in your breast milk, and I think that there may be some chance that some of that would be transferred because your baby's getting a lot of great immune globulins from your breast milk.
Would it hurt the child
in
any
way? It would not hurt your child in any way.
Okay, that's a good
breast milk
point.
Is a great thing.
Very good. And that question leads to another, really, about vaccinations in general. It's been very confusing. Just how many vaccinations should folks get? You've got the seasonal flu vaccine, you've got the H1N1. If you're of a certain age, you should have a couple of doses. If you're of another age, you shouldn't. What are folks to do?
Well, one vaccine does not protect against the other. So if there is no reason why you can't have the vaccine, for example, an egg allergy, then to protect against both, you have to get both. Now, for the H1N1 kids 10 and over, under 10, 6 months to age 10, you would need 2 doses about a month apart. And for seasonal influenza, it's 9 and down from 6 months. And if you're under age 9, you would get 2 as well, if it's your first season for receiving the vaccine.
Okay. Kathy has a question for us. She says the pandemic flu, we're advising to not rush into the doctor's office. Well, not necessarily just the doctor's office, but not necessarily rushing to the ER. Yet the antiviral is not as effective if it's not given within 48 hours of symptoms. She says it seems contradictory. Please explain.
It can be very confusing, I think. Well, the other question is, who should be treated with an antiviral? And I think that we have to certainly focus on people who are higher at risk with underlying chronic illnesses and children who are very young, definitely under age 2 and considering under age 5. So that if you're someone without any other risk factors and you do have flu symptoms but you're not extremely ill with it, your physician will have to decide about whether or not and use his clinical judgment about whether to use some of the antiviral agents. But for a lot of people, they'll fight it on their own. They'll do just great. So if you're an older child without any major symptoms and you're actually not too ill with it, it can run its course and you can get over it without the antivirals. And I think I think people are trying to focus in on the most ill people, and it's people who have high fevers, 104 fever, and they're very lethargic or they're extremely achy and ill looking with a severe cough, and those people should seek medical attention.
We've got another question, and this is also related to the vaccine. There was also information that came out of UC Davis today talking about mercury and autism, and mercury is a hot topic when it comes to vaccines in general, and I believe this question has a little bit to do with that concern as well. Stacy, you're on the air with Docs on Call. What's your question?
Yes, I was wondering, I have a 6-month-old daughter, and the recent printing on the FDA for the N1H1 vaccine, it says it's containing 25 micrograms of thimerosal, which is a mercury preservative, and the EPA only recommends 0.4 micrograms of exposure for any human. So I was wondering why they're recommending this vaccine for infants and pregnant women when there's actually mercury in it, and they tell me not to eat tuna fish.
It's a great question. In fact, you'll probably get more mercury in the tuna fish you eat. But they actually lifted that level rule for the multi-dose vials just because they want to get the H1N1 out. But the single unit dose vials do not have the thimerosal in it. It's just the multi-dose vials.
So is that what you would recommend for her child or herself?
I would. Is a single unit dose vial if they're concerned about thimerosal and mercury